My name is Thomas Woodham and I'm a physiotherapist specializing in cardiac health and preventative exercise for general longevity. Today I'm going to be breaking down the structure and the function of the heart. I believe this is an area that is crucial to have some knowledge in, especially when it comes to being proactive about your healthcare. I'm a firm believer that movement is medicine, and if we can get people strong and healthy, the chance of certain health conditions does go right down. So today I'm going to be helping you to gain that knowledge to enable you to make more healthy decisions around your healthcare. The structure of the video is going to be a series of questions. First of all, I'm going to break down the general structure and function. Then I'm going to break down some general training principles, what can go wrong with the heart, and how you can best protect the heart. So without further ado, we're going to get straight into it. Taking a look at the heart here, you can see this is the front of the heart, and we have a right and a left side. Typically, the right and the left is orientated to how it would actually sit in your chest. So if you were looking at it like this, it may seem opposite, but we have the right side here, and then we have the left side on this side. In terms of the actual structure of the heart, we have the main muscle body here, or the myocardium, and this is the main heart. We then have the aorta, which is along the top here, and this is like a hose pipe sized blood vessel, which takes all of your oxygenated blood out of the heart into your body. As well as this, we have some other blood vessels here. So we have the vena cava, which is on the top and also on the bottom. This is the blood vessel that brings all of your deoxygenated or used up blood back into the heart. They're the main blood vessels we need to talk about. There are some others we're going to go into throughout the video. But starting off, if we take the front of the heart off, you can see that we have 4 chambers within the heart. At the top, we have the 2 atria, and at the bottom, we have the 2 ventricles. But what are these different areas? First of all, at the top, you can see the right and the left atria. The atria are basically just holding chambers, so the blood is going to come in through the vena cava, so in through the top or in through the bottom, and it's going to be stored in the right atrium. Inside the right atrium, it's just stored for a short period of time until you hear the first dum, the first beat, and then it will move into the ventricle. So you can imagine the blood is coming from the right atrium here. A small impulse is going to be created. We've got the sinoatrial node, which is just an electrical impulse creation center in the right atrium. That's going to spread across the atria, and they're both going to contract at the same time. While the blood contracts, we're going to follow the general route of blood from deoxygenated to oxygenated. So the blood is going to come from this right atrium down through this valve into the right ventricle. What you'll notice is the difference between size of muscle in the 2 ventricles. So you can see the left ventricle has a lot of muscle, and that's because it has to pump blood into the entire body. However, if you see the right ventricle here, it has got a lot less, it's a lot smaller muscle, and that's because this blood is going to come up into the pulmonary artery, and it only has to go to your lungs, which you can imagine is not very far. So that's the first route of blood. It's going to go atria into the ventricle, up into the pulmonary artery, and then it's going to come back into the left atrium, another holding chamber. In the left atrium, the exact same thing is going to happen. We're going to get that electrical impulse go across the atria. It's then going to squeeze the blood down into the left ventricle. You're going to get another electrical impulse, and then from there, this oxygenated blood that's come from the lungs is going to travel up into this thing here, which is just the valve into the aorta, and it's going to go around the body. So that's the general function. So how about training the heart? So how do you train the heart for the best overall benefits? Well, training the heart is actually quite easy. The heart is a muscle, and like any other muscle in your body, giving it some kind of progressive resistance will train that muscle and allow it to grow. In terms of the heart, there are 2 main components or 2 main adaptations that we can get from training it. First of all, the heart is a muscle, and to train it, we need to make it do more than it normally is. So at rest, let's just assume it's doing 60 beats per minute. So 60 to 70 is an average BPM. You want to raise your BPM or raise your heart rate to train your heart. For example, if I was to go and start running, 2 things would happen to my heart. First of all, my heart rate is going to go up because that's going to allow me to pump more blood out to my legs, and it's going to allow me to use my legs for my run. But at the same time, these muscles within the entire heart are going to squeeze harder. By squeezing harder, they can also pump out more blood, and that's going to fuel my body. But the importance of this from a training perspective is if you can increase your heart rate and increase the force of the heart pumping, this is a level of resistance. By increasing that resistance, you're going to strengthen the heart. A stronger heart is going to be a healthier heart, and then long term, it's going to be better for you. For example, if your heart is stronger, you could lower your heart rate. So if you're at a phase of life where your heart rate is 80, 90, 100, it's very high, you could be said to have a weak heart, and that is not going to be good for your long-term health. However, if you do cardiovascular training, you can bring this heart rate down into a more healthy range. The second component of training the heart is something called angiogenesis. Look at the heart here, you can see that there are blood vessels that are lining the heart, but there are certain areas that may be absent of a blood vessel. But this area is still muscle, it still has to function, and this is where exercise comes in. During exercise, you're going to stress the heart, it's going to need more oxygen, and so these blood vessels are going to be crucial. This is called the coronary circulation. However, the areas that have less good blood flow are still going to be functioning, and they will be slightly stressed. This stress is going to promote the release of growth factors, and these growth factors are going to promote angiogenesis, which basically just means the growth of new blood vessels. So alongside increasing heart strength, exercise is actually going to increase the amount of circulation that your heart gets. More circulation means you're getting more oxygen to the heart muscle, either at rest or during exercise, and overall you've got a healthier heart. But as well as this, saying it briefly, a heart attack is when you have a blockage in one of these blood vessels. But if you have more blood vessels, you have a better blood supply, this blockage may be less critical because the blood has other routes. So definitely train your heart. It is important, and they're the two main reasons why. As well as this, outside of the heart, by training your cardiovascular system through any kind of cardio, walking, running, jogging, anything you enjoy, swimming, you're also going to be training your blood vessels. So let's just take the aorta, for example. Imagine this just being a general blood vessel. Within the walls of the aorta, there are specialized cells that can release something called nitric oxide. By releasing this nitric oxide, it is a powerful vasodilator. So what this means is, if your blood vessel looked like this, nitric oxide is going to get released and it's going to get bigger. By getting bigger, there's less resistance to the blood flow, and so your blood pressure will go down. If you can progressively train this exercise repeatedly over time, you're going to get more nitric oxide being released, and as a result, your blood vessels will be larger for a longer period of time, reducing your blood pressure. This is obviously good for general cardiac health, but also reduced blood pressure is good for overall body health, so it's definitely worth considering through your cardiovascular training. So now let's move on to the final question. What can go wrong with your heart? There are loads of different things that can go wrong with your heart, but there are two main ones I'm going to focus on. First of all is heart disease, and second is valve problems. In terms of heart disease, this is a super modifiable condition. Heart disease is basically when you get these things called atheromas or plaques that build up within the blood vessels. Now this can be any blood vessel around your body, but it's most commonly impacting the coronary circulation or the blood vessels that flow around your heart. The reason this happens is because of two main things. First of all, you need to have something that can damage your blood vessels. This can be high blood pressure with shearing forces. You can imagine if your blood pressure is super high and it's constantly sliding down these blood vessels, it can be scraping away at the cells, causing damage. As well as this, high glucose is also a problem. For example, individuals with diabetes, type 2 diabetes, or just general insulin resistance, because there's too much sugar in the blood, this sugar can start to, almost like razor blades, start to break down the blood vessels. There are loads of other reasons, but these are just the two most common. As well as this, you also need high LDL levels, or low density lipoprotein. This is a form of cholesterol which typically keeps fatty acids and keeps the cholesterol within your blood. You also have high density lipoprotein, and this takes cholesterol out to the liver and it allows it to be processed. Low density lipoprotein keeps it in the blood, and typically this causes the plaque to build. So you get the damage, the LDL comes in and sticks to the damage, and you get a fatty plaque. This is the general cause of heart disease, these atheromas, and you can imagine if you get one building up in here, that's going to cause some problems. And there are three main things that can happen. Starting off, you have stable angina, and stable angina is just chest pain. So you can imagine if you get a blockage in this artery, this coronary artery here, everything below it, you may still get blood flow, but it will get less blood flow. And at rest, this may not be a problem. You'll be getting enough oxygen to the area and things are going to feel fine. However, it's stable because it's predictable, and you could predict that when you stand up and go for a walk, the BPM or the heart rate is going to increase, so the oxygen need of the heart is going to increase, and now you can't get enough blood and oxygen through. This is going to cause stable angina or chest pain. Moving on from this, you then also have heart attacks. And there are two main types of heart attack. I'm not going to go too much into detail, but you have an end STEMI and a STEMI. So there are different types of myocardial infarction, which means myocardium, heart muscle, and infarction means cell death. And what happens here is you get, again, the plaque building up, but they can rupture. The plaque can rupture and it can cause a blood clot. So you can imagine now you've got a blood clot forming inside this artery, and everything below it is going to be deprived of oxygen. An end STEMI is less serious. It's still a medical emergency, but you still have some blood flow. So not everything is damaged, but a STEMI, you get full occlusion, full blockage of that area, and that's going to result in cell death around here. So that's what a heart attack is. It's different to a cardiac arrest. Cardiac arrest is when you have no electrical activity of the heart, so it's not beating. A heart attack is when you actually get death of the tissue because of a blockage. That's what can go wrong in terms of heart disease. In terms of valve issues, I'm not going to go too much into detail, but you can get constricted valves, which, for example, if you get a constricted aorta, it's going to increase the pressure within the heart because you can pump less out. But you can also get leaky valves where blood flow leaks between them and then it's not flowing around the heart as it should, and that can cause its own problems. But moving on, we need to talk about the final question. How can you protect your heart for the best results? And there are two main ways that you can do this. First of all, exercise. If you can exercise for at least 30 minutes, 5 days a week, your risk of all-cause mortality is going to go down by about 40%. That's according to the World Health Organization, and this also includes heart disease. Obviously, this is super important because heart disease is the #1 killer of men and women globally. It takes nearly 19 million lives every single year. You need to prevent it. The reason this works is because there are two factors which cause heart disease. You need to have something that damages the blood vessels and high LDL levels. Exercise, first of all, will reduce blood sugar. If you're using blood sugar for energy, it's not going to be in the blood. It's not going to damage the blood vessels. As well as this, exercise will release nitric oxide and down-regulate your fight or flight system. This is going to reduce your blood pressure. Both of these factors are massive for causing damage in the blood vessels. If you can reduce them, overall, you're going to have better cardiac health. However, as well as this, exercise can reduce your cholesterol levels. So now you're not getting damage to those blood vessels, but you're also not getting the building factor for plaque. So exercise 100% can reduce the factors that cause cardiac problems and heart disease. As well as this, exercise is just super important for cardiac health. You're going to get angiogenesis, formation of new blood vessels within the area. That's going to better protect you, and you're going to get a stronger heart, which is just better for general health. The second factor for reducing the risk of cardiovascular disease is going to be diet. If you can eat more whole foods, less saturated fats, and more monounsaturated fats, you're going to have better cardiac health. This is going to reduce your cholesterol, which first of all is super important because cholesterol is a building block for fatty plaques. But also you're going to reduce your blood sugar, which is a building block for damage in the arteries. And you're going to have better overall health because you're fueling your body effectively. So for this, I'd recommend whole foods. Focus on your protein for the muscle building aspect. It also keeps you more full, so you're less likely to binge. Focus on fiber, it's going to keep you more full. And if you're going to eat fats, 100% fats are a component of the body, you need to eat them. I'd focus on more healthy fats. So some animal fats, of course, or some saturated fats, of course, you're going to get it in there and you can't avoid it. But avocado is a great healthy fat. Fish and fish oils, another great healthy fat. Olive oils, another great one. It's all about moderation. And if you're worried, obviously speak to a dietitian or your doctor to get a full plan. These are just some suggestions. Overall, that is a brief breakdown of the heart. You know now what its function is, how it works, the electrical activity, but also how to train it and how to modify your diet for the best heart health. So if you want to go forwards, make healthy changes, these are just a couple of things you can do, and you now have the understanding of why it works. And yeah, if you want to learn more, hit the subscribe button, because I'm going to be releasing 2 of these videos every single week, not necessarily just about the heart, but general longevity to help you be more proactive about your health. And just as a quick disclaimer, this is not medical advice, and this should not replace full assessment and medical advice from a qualified doctor. Obviously, I am a qualified physiotherapist, but I have not given you a specific plan and I have not assessed you. So this may not be best for everyone. Always check in with a specialist if you want to make any dietary changes or you want to change your exercise plan, because it's always best to be sure, because it's better to be safe than sorry.